Okay. Okay, hey guys, my name is Chris. I'm the Helpful Pharmacist, and today we are going to give you some great information about how you can drastically change your health at home through some very simple things to be mindful of, specifically in this case for cardiovascular disease. So like I said, my name is Chris. I am a biochemist and a pharmacist, and today we're going to talk specifically about cardiovascular disease and what you can be doing at home to help prevent, minimize, and understand that. So let's get started here. So the first thing that I want to talk about is that there are very few things in this life that we can have control over. It's just a common knowledge. It's hard to control things. Nothing's in our control. And one of the big takeaways for today is that you can control your heart health or your cardiovascular disease health. And I think that's a really exciting and unique concept because, like I said, there's not a lot of things in this world that we can have control over. And so I really want people to have that be the big takeaway, is that you have the ability to shape this. And as you'll see, there are a few things in your life that are going to impact your future more than cardiovascular disease or your heart health. Okay. I also want to throw in here that this term of health literacy, which I'll define in the next slide, I'll actually just use that one first. So what is health literacy? This is the ability to find, understand, and use information to help inform decisions with services. So basically, it's a fancy word for education. The more you understand about your health and the system in which health takes a role in, the better it's going to be. And again, I'm sharing this because I found the study this week that really put it in words best, which is that it is one of the strongest determining factors of your health. It's more impactful than age, income, employment status, education level, anything. So again, we're talking about what we can do, what we can have control over. It turns out doing what you're doing right now, sitting here and spending 20 or 30 minutes and getting some education about how your health works and what you can be doing to learn and understand more of it, there's really nothing else that's going to impact your health more. And I think that's such a beautiful and empowering concept. Like I'm saying, the goal here is to make people feel motivated and realize they have a lot of ability to drive things here. And this just really drives that point home for me in a way that I'm really excited about and want to share it. Good. So the first one is we're just going to define cardiovascular disease real quick. This is basically issues with the heart. The most common ones are going to be clogged arteries, which can be called heart disease or coronary artery disease. Things like heart attacks, strokes, heart failure, arrhythmia, and heart valve issues. These are the most common topics when we're talking about cardiovascular disease. And just to give some sub-examples here that I think are really important to mention, is it turns out 1 out of every 5 heart attacks that occurs, the person who it happened to was not aware of it. So imagine that, having a heart attack and not knowing that you had one. How scary is that? Especially because once you have a heart attack, it basically increases the risk of it happening again by a factor of 2 or 3 or more. So that's a really powerful concept. At the same time, for strokes, the statistic shows about 1 out of every 4 of them is also silent. So there's a lot of people out there having heart attacks and strokes and not knowing they occurred, and they need to make a modification or a lifestyle change. So that's a really important concept I want to drive home. Another statistic for people that are a little bit older, that by the time someone is 60, there's a 10 or even potentially 20% chance they've actually had a silent stroke. So that roughly translates to anywhere from 1 out of every 10 to potentially 1 out of every 5 people over age of 60 right now walking around has had a stroke and they weren't aware of it. And that's a great example of health literacy and understanding your body, how your body works, and when things happen, knowing what occurred. So I think that's a really important example of why conversations like today are so important. Also want to talk about, again, why it matters, taking a further step back, because obviously there's a lot of information around and we can't learn all of it. We can't apply or invest energy into all of it. So I always want to tell people, this is why you need to do this. This is why you should learn this, because there's not a good reason why spend your time, right? So the easiest way to say it is heart disease is the #1 cause of death in the United States. Straight up, flat out. It's the #1 thing that kills people. There's about 700,000 deaths every year in the United States due to heart disease, and that's roughly 1 out of every 5 deaths. So if you're worried about dying, which I'm sure we all are, odds are it's probably going to be heart disease when you compare them all, which obviously makes anything you can do to help prevent that important. Another study found that about half of all adults have some form of heart disease. So if you're sitting there thinking, oh, this can't be me, unless you have labs to prove that, you may want to get them labs and double check that, because basically half the people out there have this. Again, it applies to everybody. And that's why we see it as #1 cause of death in the United States. It's hard to escape in terms of whether or not it's going to affect you. It can also begin as early as your 20s. So for a lot of people out there that are young and they're thinking, oh, I'm listening from my parents, my grandparents, I just want to learn more. Well, it turns out this can start as early as your 20s, and then it's really never too early to stop or modify things that you're doing that could be negative for your heart health. Important takeaway. But I also want to emphasize that it doesn't happen in a single day. So it's something you have time to prevent, time to basically change your path, and you have the ability to see it coming. So it's not something that you wake up one day, it happened, and you're done. You have the ability to work towards this. You have the ability to prevent this. And when it does start to become obvious or diagnosed, you have the ability to prevent its progression and potentially reverse it. And I think, again, the idea to empower you, it's never too late. It's never too early. It's a unique concept. Some other reasons real quick why this matters is that for your blood pressure, for every 20 points the top number goes up, it's going to double the risk of basically having heart disease. And for every 10 points the top number goes down, it can reduce the risk of a stroke by up to 40%. We're going to talk about that more. But again, if we're worried about heart disease and stroke, there's a lot of things we can do to modify that, is the point there. So the number one thing that I always tell everybody, this kind of drives me crazy, is you got to know where you stand. You know, you ask people, like, how's your health? Oh, it's fine. How do you know my health's fine? I don't know. I went to the doctor 5 years ago and they said I was fine, so I'm fine. Doesn't really work like that. And that's one of the big takeaways here, is that if you don't know what your health is, if you don't know what your lab values are, if you're not actively working towards it, you need to ask yourself some questions, and we're going to kind of talk about that here. But really, you can't fix what you're not aware of. So it all starts with being aware of what's going on, having that honest conversation with yourself, your family members, maybe your doctor, whoever it may be, okay? And again, some examples of why this matters is 1 out of 5 people who have high blood pressure, they don't know they have it. So this goes back to the idea that, oh, you know, I measure my blood pressure once a year and it's fine, so I'm good to go. It doesn't really work like that. You need to be measuring your blood pressure a couple times a month at a minimum to have any idea of what direction your blood pressure is going in and how concerned you need to be. A lot of patients will say, oh, I'm on blood pressure medication, so my blood pressure is fine, I don't have to worry. Well, you're on blood pressure medication because you have a problem. And so obviously those patients have more of a need or a reason to measure, not less. At the same time, if you're on medication and you're not measuring your blood pressure, how do you know if it's working? There's also the potential that your blood pressure medication could be dosed too high and causing low blood pressure, which is also an issue. Causes falls, confusion, dizziness, fatigue, lots of things that aren't good. And if you're not measuring your blood pressure at home, you're not going to know that. So one of the biggest things that really affects me is when people say, oh, I went to the doctor 9 months ago, I'm fine. I measured my blood pressure 9 months ago, I'm fine. I'm on blood pressure medication, I need to measure it, I'm fine. It doesn't work like that. You need to measure it to know. And I also just want to talk about, again, how some personal examples of patients I talked to. I had one a couple of weeks ago. Guy came in at the pharmacy. I ask every patient, what's your blood pressure? Very casually, he's like, oh, you know, it's like 175 over 105 or 110. And I'm just like, what? Like, please, sir, sit down. We need to have a conversation. You're at so many at risk of so many things right now. So there's a lot of people out there walking around that are literally not that far away from having a heart attack or a stroke or something worse, and they have no idea. Or they don't understand the impact of it or how to evaluate it. And so we're going to talk about that today. And just to kind of give you some information real quick, I recommend everyone measure their blood pressure 1 to 3 times a week, depending on how sick you are or how old you are. And I personally recommend the Omron brand for blood pressure monitors. I tell people it looks like Omar. So if you remember Omar, when you see Omron, you'll remember it. Omron 3, they're like $35. Almost everyone can afford that. And again, if high blood pressure and cardiovascular disease is the leading cause of death, for $35, I challenge you to find something that will change your health or your life more than spending that money. It's something everyone has to have, and everyone can afford it, in my opinion. Real quick, we want to talk about blood pressure because this is typically how we measure cardiovascular disease at home. The top number is the systolic. This is the pressure when the heart contracts. And the bottom number is the diastolic. This is when it relaxes. So your heart beats, pushes blood out, it relaxes, it fills with blood. It beats, it pushes the heart out, it relaxes, it fills with blood. That's how your heart works, okay? And again, understanding the values is that, so just checking the chat here, sorry about that. The goals, so we've all grown up hearing 120 over 80. That is by far still the gold standard. That is where we should all hope to be. And just anecdotally, every time I talk to a cyclist or a runner or an endurance athlete, it's the same thing every single time. It's always either a 115 over 65 or a 110 over 60, always. So what we always see is the people who exercise the most always have the lowest blood pressure. And the goals, what I'm trying to establish here for those people who have really good habits, typically around 115 over 65. We should all strive to get to that. I'm proud to say that's what my blood pressure is. I typically do 2 to 5 hours a week of cardio, typically more towards the 10 range lately, but my blood pressure is typically always around 115 over 65. My heart rate's at 60 or below. I can tell how athletic someone is when they tell me their blood pressure and their heart rate, just to give you that example. The medical guidelines, they typically recommend 130 over 80. That's the current recommendation for all ages. So based off the literature, that's where you want to be to give you that reference point. And I teach patients anything over 140 over 90, it's time to be concerned. So we want to give you the goal, the guideline, and the time to get concerned. Anytime you're getting close or over to 140 over 90, you need to really evaluate what you're doing. Start measuring your blood pressure a couple days a week. And if changing your diet and your exercise doesn't get it back under within a couple of weeks, you need to call the doctor, make an appointment. And if you have any health issues, you've had a history of heart attack or stroke, you definitely need to go call your doctor immediately because, again, it's a risk factor. And we established 2 slides before using this example here. If you go from 120 to 140, you're basically doubling the risk of a cardiovascular event happening, like a heart attack or a stroke. And the converse is true. If you go from 140 to 130, reduce it by about 40%. So a lot of patients will be like, oh, like who cares, right? 130, 140, 150, it's all the same. It's not. And so that's the easiest way to explain it is for every 20 points it increases, you're going to double the risk of that happening. And typically for every 10 points you're going to reduce it by half. So to give an example of why going from 140 to 130 is so important, or 130 to 120 or 120 to 110, just to kind of explain that. I also want to make sure people understand the upper limits and what to do when those occur. So typically once you're hitting 170 over 100, you got to go be seen. So the first thing you want to do is you want to measure your blood pressure again. So wait 15 minutes, get as relaxed as possible, sit in a room and just kind of meditate or watch TV, whatever you do. Get nice and relaxed, measure it again. If it's still at 170 or over 100 or higher, you got to go do something. That's my personal and professional opinion. Because at that point, the risk of you having a heart attack or stroke right now and right then is like 3 to 10 times higher. It's a huge risk factor. And I've talked to a lot of physicians about this, and I tell them, oh, I was talking to some patient yesterday. Their blood pressure was like 175 or 110. And this one physician, he'd always say, that person's about to have a heart attack or a stroke. And this is a physician saying that. So it's not just my personal opinion, plus the guideline. Some people may not want to go to an ER. I understand that. There's long wait lines, whatever it may be. You could go to an urgent care if you're around that point. They can evaluate you. They can make a decision. They're going to be a physician. There are some medications like clonidine, which are prescription items. You take clonidine, it works within 1 or 2 hours. They could give you clonidine, get it back down, give you the ability to go home, sleep in your own bed, call your own doctor tomorrow, make an appointment, be seen. The big thing is anytime the top number is 180 or higher, or the bottom number is 110 or higher, you absolutely, without doubt, need to go to the ER immediately. The risk of having so many issues, stroke, heart attack, aneurysm, kidney issues, eye issues, almost everything is a risk factor at that point. You need to go and be seen. So that's a big takeaway. Okay, so now we're really going to focus on how can we prevent this, because that's what the whole topic is here. We want to be empowered. We want to have control over this, like I promised, and now I'm going to explain that to you. So the thing that's so interesting about this is that the solutions are relatively simple. They're relatively cheap. They don't need to be complex. They don't need to be fancy. They're simple things you can do at home on a daily basis. And the first one, as you may have already guessed, it's going to be exercise. So studies have shown that somewhat regular exercise can reduce the risk of cardiovascular disease by around 30%, which is a lot. There's not a lot of things in this world that produce a 30% benefit. For people who do the stock market, we talked about a 30% return or 30% loss. Their eyes are going to go like that as a reference point. 30% is a lot in almost any field or industry. So again, the studies have shown that regular physical activity can lower your blood pressure or the risk of having high blood pressure by 35%. 120 minutes a week, which is typically the goal, has been shown to have a 20 to 30% reduction in cardiovascular disease across the board. And it's also been shown to potentially reduce the risk of a stroke by up to 27%. And for even people with moderate level of activity, they still get a benefit. So any amount of exercise is always going to help you. And if you're able to follow the recommendation of 20 to 30 minutes a day, you can pretty confidently expect a 30% reduction, which is a lot. And remember, we're talking about cardiovascular disease as being the #1 cause of death in the United States. So if I asked you if you could reduce the #1 problem in your life, the #1 cause of death by 30% for 20 minutes a day, I'm pretty sure you'd be interested in that. Yet when you go out and you actually talk to people, you don't see that translated into their actual life, their actual decisions. So that's why we're having this conversation today. We're trying to break it down into relatable terms that you can actually understand so that you can be empowered, you can be your own health leader, you can make your own health decisions. Not here to tell you what to do, not here to scare you, not here to do whatever. I'm here to educate you so that you can understand this and then you can make your own decisions, because that's how sustainable change happens. And I think the evidence is pretty clear on its own. Another really big topic we always want to talk about for cardiovascular disease is weight management. There's a huge correlation. So typically for weight, we talk about BMI, body mass index, which is basically a fancy way of saying weight divided by height. You can just Google BMI calculator. It comes up. They're all the same. Put in your height and your weight tells you your BMI is. So typically under 25 is fit. 25 to 30 is average. Once you go above 30, that's considered obese. And depending on which guideline you look at, either above 35 or above 40 is considered to be morbidly obese. So typically you want to be minimum below 30. Once we're over 30, we're going to really need to be concerned and do something about it. And for most people, being under 25 is a goal, a good goal. Just want to preface that muscle can skew this. So any professional bodybuilder, any professional NFL player type thing like that, their BMI is probably between 30 and 35. That's because they have 50, 60, 100 pounds of muscle. So if you're someone out there with a lot of muscle, BMI is not the best way to measure it, and most of those people are aware of that. So the reason why we're using BMI is that what we've seen in studies is that if you increase your BMI by 5 points, you could increase the risk of a stroke by 40%, and you could increase, again, the risk of cardiovascular disease by up to 30%. So the example would be is if your BMI went from 30 to 35, you're going to increase the risk of a stroke by potentially up to 40%, which is huge. It's a massive change. And again, 30% for cardiovascular disease, another huge change. And we also want to give the example that this is for a person who's 5'7", kind of picking a height that's between most men and women. That would mean gain or losing 30 pounds. So I think we've all had a friend in our life who at some point gained 30 pounds or lost 30 pounds. It's something we can tangibly understand based on our experiences. And what the studies show is that that would potentially reduce the risk by 30 to 40%, if not more. So that's a really important thing to be mindful of. Weight management plays a huge thing into this. We're not really getting into the subject of weight management today because that's its own subject, but I always teach people the rule of 100 calories, which means that a pound of fat is 3,500 calories, and there's roughly 30 days in a month, which means that if you eat 100 calories a day more than you burn in a month, that's about 3,500 calories, which is a pound a month. So if you eat 100 calories a day more than you burn, you're going to gain about 1 pound a month or up to 12 to 15 pounds a year. And the converse is true. If you can reduce your intake by 100 calories a day, you could potentially lose a pound a month or 10 pounds a year. So I have some people that are like, oh, eat a cookie. It's just one cookie. Have a scoop of ice cream. It's just one scoop of ice cream. Well, that's 100 calories right there. If you have a cookie every single day, that's 1 or 2 pounds a month probably, at minimum 1 pound, and potentially 12 to 15 or more pounds a year you're going to gain from that one cookie a day. So that's how I'll start off with weight management. Just to go quick aside, 100 calories can make or break you. And when you have that understanding and you look at what you eat, it really changes it. You can also apply it to taking some food off your plate. I don't need, this amount of that. I just need that amount. Reducing your portion size by 10 or 15% easily gets you to that 100 calories. If you do that with every meal, it makes it really easy to manage or lose weight, is my personal advice I give patients. Another big topic that we always want to talk about with heart disease or cardiovascular disease is smoking cessation, quitting smoking, tobacco usage. So smoking has been shown to increase the risk of stroke by up to a factor of 2. It can increase the risk of a heart attack by a factor of 3. And it can increase the risk of coronary artery disease or artery disease in general. That's when you have cholesterol and plaques in your arteries by up to a factor of 4. So again, if we're talking about risk and benefit in reducing things that have high risk. Smoking's by far going to be the biggest risk factor. Again, we're talking about a factor of 2 to 4. That's a huge risk factor. So for people out there that are smokers, you may or may not already know this. We want to emphasize that point again. There's probably nothing more that's going to negatively impact your health than smoking. We're not trying to make anyone feel bad. Again, we're trying to educate and empower that it's an easy change to make. I also want to tell people, for our real smokers out there that are pack a day, 2 packs a day, you don't necessarily have to go down to nothing or zero. Going from 2 packs to 1 pack, that's a big difference. Going from 1 pack to a half of a pack, or from 1 pack to 4 or 5 cigarettes a day, there's a lot of benefit there. So you don't necessarily even have to quit or go all the way to zero to get a lot of the benefit. Something's always better than nothing. I also want to include, just so we're all aware, for smoking cessation for tobacco, it can be extremely difficult. No one is denying that. No one is trying to shame anybody. I just want to make sure people are aware that every study has shown that when you try to quit by yourself, that's the hardest. If you go to some type of a class once a week, a couple times a month, increases the quit rate by 20 to 30%. If you take some type of a nicotine product, whether it's a patch, a gum, or a lozenge, typically you're going to get a 30 or 40% increased quit rate. If you do both of those together, it's typically like 40 to 50%. So that's what I recommend everybody do if you're trying to quit, is find a class. Usually dial like 1-800-TIME to quit or a quit hotline. You can just Google it. You can find the phone number in your state or your area. There's a bunch of free programs that are available. So if you do that class plus those OTC products, you're going to basically double the chance almost of quitting. There's also some prescription medications called Zyban or Chantix, which are typically prescriptions in most states. And those actually have more than a 50% success rate. So I want to make sure people understand that quitting cold turkey is typically not the best approach. Quitting by yourself is typically not the best approach. Going to a class definitely helps. Taking medications helps. And the gold standard is doing both. So I just want to emphasize that point real quick because it's a big component we're talking about today. The next point, and this is kind of like the main last point here, is the role of prediabetes and diabetes and cardiovascular disease. So for people who aren't maybe aware, prediabetes is when you have an A1C of 5.7 to 6.4. And there's about 90 million people in the United States as of today who fall into that category. So roughly 1 out of every 4 Americans is pre-diabetic. So odds are, if you're listening to this, either you or someone you know is pre-diabetic, you fall into that category. And that's been shown to have a 20 or 30% increased risk of cardiovascular disease. Again, the number 1 cause of death. For people who are diabetic, which we're going to define here as an A1C over 6.4, so 6.5 or higher, it's been shown to have a 2 to 4-fold increased risk of cardiovascular disease. Again, the number 1 cause of death. So imagine if you are a smoker who is diabetic, you're probably looking at between a 4 and 10-fold increased risk of getting cardiovascular disease, just to put that into a context. Statistics don't typically stack, so you can't say 2 plus 2 is 4, but generally speaking, there's a lot of synergy there. So that's going to be one of the biggest things. And for people who are wondering, am I pre-diabetic or diabetic, it's very easy to find that out. You just get a lab order from a doctor. Some places can do them without one, depending, and get your A1C done. A1C is a very simple $15 or $20 lab. It takes 5 minutes to do. They take 1 little drop of blood from your finger or take a vial of blood, depending on how they're going to do it. And it tells you what your blood sugar has been on average for the last 90 days. It's the gold standard for evaluating this. And I highly recommend everybody do it at least once a year, if not twice a year. Again, just like there's nothing that you can spend $35 on to affect your health more than a blood pressure monitor, I would make the case that getting your A1C done once or twice a year is probably the second. And even if your insurance doesn't cover it, which it usually covers at least once a year, or if you want to do it twice a year and the insurance doesn't cover it, paying the $20 or $35 it's going to cost to do that, that's immense benefit because it helps you understand if what you're doing is working, if you're going in the right direction. Again, this is a huge driver. And most people understand that once you become diabetic, it's pretty hard to reverse that. You can do it. Most people don't. There's about 30 million people in the United States that are diabetic, maybe a little bit more. So again, we're talking about 1 out of 10 Americans being diabetic, 1 out of 4 Americans being pre-diabetic, and roughly 1 out of every 3 or 4 Americans fitting somewhere in one of those 2 categories. So again, odds are this pertains to you or someone you know. At this point, diabetes is epidemic, and we want to make sure people understand it's one of the biggest drivers of cardiovascular disease. which again, like we're saying, is the number one cause of death in the United States. But hopefully you're starting to see it doesn't have to be. It's pretty easy to prevent. There's a lot of things you can do. We're going to talk about that in our wrap up here now. But before we get to that, one of the closing points I want to include here is you need to know yourself. And what I mean by that is a lot of people, they don't know what their health is. They don't know what their blood pressure is. They don't know what their BMI is. They don't know what their A1C is. We didn't talk about it directly, but they don't know what their LDL is, which is their cholesterol value. They don't know these things. These are the 4 biggest drivers besides smoking of cardiovascular disease, which is the number one cause of death, and you don't even know where you stand. So again, it goes back to the first point, which is you need to know where you're at because you can't fix something you're not aware of. If you do not know these 4 things, you're really guessing with your health. And these are all very easy to do. You can do all of these in one lab visit, basically, if you have a scale and a blood pressure monitor at home. Otherwise, it's 2 visits. You're looking at like $40 or $50 in most to do all 4 of these things. There again, nothing else is going to be more benefit than doing these. And what I've come to tell patients is that these 4 variables or parameters are basically the social security numbers of your health. And so what I always say is just like almost everyone knows what their social security number is, everyone needs to know these 4 things. In the modern world, that's the way it works. Just like you know your social, you got to know these 4 things. What's my blood pressure? What's my BMI? What's my A1C? What's my LDL? You got to know those. There's really nothing else that's going to impact your health more than that. These are the 4 simplest, easiest measurements that exist. Some of these can be done basically for free, especially if you have insurance, and none of these are going to cost more than $10 or $20 or $30 individually to do. So that's one of the biggest takeaways, and one of the biggest things that bothers me when I talk to patients is they say, oh, I don't need to talk to you. I don't need help. I saw my doctor 9 months ago. I'm totally fine. What's your blood pressure? I don't know. What's your BMI? I don't know. What's your A1C? I don't know. What's your LDL? I don't know. Then how do you know you're healthy? Because I just know. Again, it's time to take this serious. Who wants to have a health issue? Who wants to have a health concern? I know I don't. I want to be able to take care of my family. I want to be able to make a good income. I want to be able to do the things I enjoy doing and take care of those people and see them have good lives. And one day I want to retire, hopefully, and be able to do whatever I want for the rest of my life. And if you don't have health, it jeopardizes all of those things. I have a family friend who just retired 2 years ago. He has heart disease. He has arrhythmia, and he can't go on vacations anymore. He worked his whole life, 35 years, 2 years into retirement, done. Can't go on vacations anymore. He tried to go on vacation last month. He had a heart issue. He had to go home and sit on the couch while his wife finished out the vacation. She actually just took her first vacation by herself last month, or this month, I should say, because he can't go anymore. She went to go to Wimbledon and watch them play tennis, and he literally sat on the couch and ate frozen food by himself at 70 years old in his retirement because he didn't manage his heart health. He didn't do these things we were talking about. And I definitely wager to bet that there are things he could have done that prevented that, especially these 4 things we're talking about today. So that's an important thing. Also want to talk about a lot of people out there, you have a heart attack, you have a stroke, you get neurological issues, you can't drive, you can't see, you can't work. We all understand you got to have money, you got to have a job. A lot of people don't realize that when you lose your health, oftentimes you lose the ability to work. And that could be not only a game changer and a life changer for you, but your family. You may take care of your parents, you may take care of your siblings, you may take care of your wife and your family and your children. They rely on you. You need to be healthy to take care of them. And if you're not doing these 4 things, you're really taking a risk for that. Then not only are you going to have to deal with potentially, but those people will as well. And I think that's something we all want to avoid. So again, the take-home message here is that you have the ability to control your future. You really do. There's not a lot of things in this world that you can control, but I'm telling you right now, heart health is one of them. There are so many simple things that you can do that have a meaningful benefit. We listed at least 4 or 5 things that have at least a 30% reduction. And again, they don't all add up. You can't say, okay, it's a 120% reduction, but there are going to have a major impact. So again, measure your blood pressure at home once a week. The most important thing, number 1 driver of cardiovascular disease, especially heart attacks and stroke, high blood pressure. Next one's going to be exercise. It's 20 minutes a day. You really don't have 20 minutes a day to go outside and walk around your neighborhood? I'm sure you do. Like, you can watch TV while you're walking, listen to a podcast. There's really no excuse why you can't go walk for 20 minutes a day. And then push yourself. Maybe one day you go 45 minutes. Who knows? Again, weight management is a major topic. I think we're all aware of obesity and it's not being good. And we've shown here the impact that it can have. I talked about the 100 calories a day concept. All you got to do is eat 100 calories a day less or 100 calories less per meal. And basically be able to manage your weight and get the benefit from that. Plus you get to look good and feel good, because obviously who doesn't want to look good or feel good? So we didn't talk about any of that during this, but there's also those benefits. Do you want to have more energy? Do you want to sleep better? Do you want to look better? Do you want people to respond to your presence when you walk into a room? Well, if you're overweight and you're huffing and puffing and you have heart disease, that's probably not going to be a good response. So there's so many benefits just beyond the medical benefits of doing these things. It will literally transform your life. Smoking cessation, we talked about. If you're a tobacco smoker, try to reduce or quit that. That's a huge driver. And then again, the idea of getting your A1C done at least once or twice a year to make sure you understand, are you pre-diabetic? Are you diabetic? Are you trending in the wrong direction? Because we all understand that diabetes is an epidemic. Nothing good is going to come from it. And if you're not getting your labs done, you're not going to know what it is. I want to mention anecdotally, I'm actually wearing my very first CGM today. So I put a Dexcom on. So I'm pretty excited. I've been measuring my blood sugar on my phone today. It is a prescription item, but for a lot of people out there that are especially over 50, that's something that doctors will prescribe for you. Even if the insurance doesn't cover it, it's typically $75 for one sensor. So it's just something to throw out there in terms of prediabetes and diabetes. You can wear a sensor for 14 days and get a really good idea of where you stand on that. And I just want to leave you with some action steps, because we all hate someone who talks, but doesn't give us examples of what we can do. So we're going to finish here with examples of what you can do. Make it really concise, really easy. So the first one is basically everyone measure your blood pressure once a week. Keep your monitor where you watch TV. When you're sitting on your couch at night, hopefully after you went for your walk, pull it out, put it on, push the button. 30 seconds later, it tells you what it is. It's that simple. It literally takes 30 seconds. Go for a walk for 20 or 30 minutes a day. That's it. That's all you got to do. If you want to ride a bike, that's great. If you want to go swim or play basketball or play tennis, that's great. If you want to go lift weights and bench press, that's great. Just go do something for 20 or 30 minutes a day. Change your life. Try to eat 100 calories less per meal, or at least 100 calories less per day. Or when someone offers you a cookie or a scoop of ice cream, ask yourself, do I really want or need those 100 calories? For people who smoke, again, Google smoking cessation or quit smoking. Every state has a free hotline with free information. They can definitely set you up for success there. And remember, you want to do a class plus medications. Do not try to do it by yourself. And again, try to get your A1C measured at least once a year, really for all ages, the easiest way to determine your health. So again, today we're talking about things you can do at home to change your life and change your health. Today we picked cardiovascular disease because it's the #1 cause of death. Again, the #1 cause of death. It's not 2 or 3 or 4 or 5. It's not something that may or may not happen. 50% of all people have cardiovascular disease. 1 out of 5 deaths are due to cardiovascular disease. There is nothing else in the health world that will drive your health more than heart disease. And it's simple. Measure your blood pressure, exercise, watch what you eat, and don't become diabetic. My name is Chris. I'm the Helpful Pharmacist. If you have any questions, you can subscribe or put in the comments. I can also be reached on my email, which is welcome@yourpersonalpharmacy.net. Our website is yourpersonalpharmacy.net as well. And we have a bunch of great information on there. We also have our YouTube channel with a bunch of other videos. More to come. We're basically breaking out an entire series of health. It's going to focus on heart health, cancer, diabetes, dementia, anti-aging, and general health. Those are going to be the big topics. But if you guys have specific things you want to learn more about, we're open to that. And again, the whole goal, going back to the very beginning, is health literacy. Understanding your health, understanding how to measure your health, understanding what drives your health is the #1 thing for health in terms of being successful. So conversations like this, learning, listening, practicing, asking questions, that's how you're going to get it done. Again, thank you for listening. I hope you guys learned something. Thank you and have a great day.